Hi, I'm Dr. Jasleen Chhatwal. I'm a psychiatrist by training, and we're talking today about anxiety. Generalized anxiety disorder is a very common disorder. It affects about 2.5 to 3% of the population and typically is seen to be more common in women than men. We notice that generalized anxiety disorder can occur across the lifespan, so in young children all the way through older adults. So it is a fairly common condition that can affect many people. Typically, to get diagnosed with a generalized anxiety disorder, a person would have to be seeing a mental health practitioner, such as a therapist or a psychiatrist, sometimes also primary care doctors who are very well versed in psychiatric conditions may be able to make an initial provisional diagnosis. If you want to help your loved one who has such a diagnosis, it can always be helpful to have a candid discussion with them, asking them about things that cause them greater worry, and see if there are ways that you can support them in their efforts to get treatment and also in their efforts to reduce their level of worry on a day-to-day basis. We notice that with generalized anxiety disorder, often anxiety around a situation or a specific instance can be out of proportion with what is commonly present. So it's really helpful not to tell the person, oh, don't worry, or don't worry so much, or even sometimes letting them know that they're worrying out of proportion. That typically may increase their sense of isolation and their feeling that nobody really gets what they're going through. So it can be helpful to let them know that maybe you don't share that level of anxiety or worry, and encourage them to reach out to a mental health professional for help. Resilience is a sum total of all the things that give us reserve, bounce, ability to really come back from some sort of stressful or difficult situation. So resilience in some way can be a counterbalance to anxiety, but also sometimes getting through an anxious situation or a difficult situation can help bolster our resilience as we start to realize that we may finally be able to overcome something like that and have the experience of success in overcoming a difficult situation. However, when it comes to clinical anxiety, even if somebody is very resilient, but if they have clinical anxiety, they still may worry quite a bit and have the symptoms of anxiety that we've spoken about the last few weeks, even if they are a very resilient person. So the two don't have to be separate, but definitely when we are more resilient and we have been intentionally building up our resilience, we may notice that anxiety may impact us less or cause less functional disability. Thank you so much for tuning in this month and listening in to all the questions we answered around anxiety. Next month, we'll continue Friday Facts every Friday, and we'll be talking about depression. Please feel free to send in your questions, and thanks as always for listening. Bye-bye.